All new tonight, community members weighing in the district's new Office of Migrant Services. The D.C. Council's hearing just wrapped up a few hours ago. D.C. News Now's Katie Reed joins us from the newsroom to break down some of those concerns. Katie, what are they saying? Good evening.
Good evening. Now, the overarching majority of the thoughts of people who testified during that Human Services Committee hearing earlier today, they were in support of continuing aid to migrants that are arriving here in the district, but a lot of them had concerns about the creation and also the operation of that Office of Migrant Services.
As a D.C. resident, I want my tax dollars to cover the most vulnerable.
D.C. Council is taking the next step towards permanent protections for migrants in the district. Thursday, they held a public hearing to address community concerns regarding the proposed Migrant Services and Supports Act. Many who testified supported the idea of continued aid for migrants here in the district.
Our government is attempting to provide access to health care, enrolling children in school, providing emergency shelter and assistance, and obtaining documents and helping to locate family members and friends in the United States. Our government's emergency attempts to assist migrants need to be specialized and implemented permanently.
Others highlighted concerns with the new legislation, which could make changes to the Homeless Services Reform Act of 2005. This could potentially limit certain migrants from accessing homeless services.
Unfortunately, this legislation in its current form blatantly excludes immigrants and asylum seekers from the housing, medical care, and other social services they are entitled to, and flies in the face of human rights for those arriving to D.C., as well as the immigrants and asylum seekers that have made D.C. their homes for years.
Migrants and the unhoused community in D.C. are oppressed by the same system and the same government, and we do not need to create separate but equal offices to support community members who are from, or come from in many cases, not willingly, to stay in D.C. Make the OMS, but don't block people from our continuum of care.
Now, this is one of many steps that has to be taken before this legislation can be put into place permanently, and we'll obviously keep you up to date on that. In the newsroom, Katie Reed, D.C. News Now.